So we have, in the beginning, we had just the map of the body with the head at the bottom, the feet at the top, and the spine outlined the concha wall here. This was the cervical spine up to about the concha ridge. This was thoracic vertebra, and the L1 level is a little notch right about this level to L1 for the lumbar vertebra, and this was the sacrum extending all the way back underneath the ascending branch of the helix. In the late 70s, Dr. Noget, we've been using the 3 dermal layers, what he calls the phases, and we were using what we call the auricular cardiac reflex, measuring pulse changes at the radial artery to verify some of the same points the puntoscope and the devices were picking up. And we were treating the TMJ and the headaches down here and the upper cervical headache here, but we got to use in the second phase, which goes across the concha ridge here, and the endodermal layer. And initially the cervical was this direction, thoracic and lumbar and sacrum against the concha wall. But in 1989, Dr. Noget reversed the spine, and I feel comfortable in saying that it really enhanced our capabilities, because at the cervical level, you also may treat a sacrum like the Lovett Brother effect. You can treat C1 and affect S5, C2 and affect S4. So we may be at the cervical level but relieve a sacrum problem, or vice versa. We may be at the sacrum and relieve a headache, as an example. So many times, we get multiple results because of the way we look at the ear now, and we're more precise with our points. So this was the third phase vertebra, cervical here, thoracic, lumbar, and sacrum on the trachea. So this is exactly where, on the chart, the cervical, thoracic, lumbar, sacrum. This will get at least 70 to 80% to a degree out of pain just looking at this area alone, if you measure for that point. And we're measuring a little more precisely than we did back in the early stages in the 70s. Of course, the puntoscope was developed in the 60s. We started using it in the 70s, and quite a few in between with different devices that measured the same way. This shows the third phase. The spine is cervical, thoracic, lumbar, sacrum. This shows the third phase, upper extremity on the lobe here. And this shows the hip, the upper leg, the knee, lower leg, and the foot down in here. Of course, the foot extends and the toes extend on out in this area of the anatomy. This shows Dr. Noget's first phase visceral. This is our workshop book that shows the morphological features of the ear. And if you're looking at taking the exam, we also have a certification program, Auriculotherapy Certification Institute, that was founded back in 1999 at the first international conference we had in the U.S. Terry Olson and I organized that conference, and this was the conference. It's at Tropicana in Las Vegas. This is some of the faculty that we found that we had at this, 40 faculty from all over the world. This is Dr. Terry Olson. This is some doctors from China. This is Dr. Mary Nan from France, Dr. Frank Bauer from Germany, Dr. Ralph Allendale, he was in Florida at the time, Dr. Dvorkin from Israel, Dr. Cho from Korea. He was replaced by another doctor at the same facility that was an ophthalmologist, Dr. Bill Tiller, that was at Stanford. This is me, Jim. This is Dr. Murrah at Columbia University that teaches some work in digital lowering technique. Dr. Lee Chung Wong and William Wong from, they're in Florida, but they're Chinese medical doctors. And Dr. Ong is past president of the Canadian Acupuncture Group, and Dr. Tony Lam, he's also from China. Dr. Ackerman, he's from the U.S., Dr. Fremelman from Israel, but we had doctors from all over the world at this conference. We had Dr. John Sonneridge that we were in China with back in 1982, Dr. Richard Yenny from Kansas City, and Dr. John O'Mara that teaches a lot with the MRI, the electromagnetic imaging. We had 25 of the set 27 pre-conference workshops at that meeting. So what we're doing, to show you on an actual ear, what's an important area that we found in the very beginning where we were looking at these points, as I mentioned earlier, that the cervical was up here in the beginning, but this is the way we place them now. The little yellow one is at the cervical level. Between that and the red one is the cervical. Between the red and the white one, or yellow one, that's the thoracic vertebra. Between the yellow one and the blue one is the lumbar, and on up to the red one is the sacrum. The little white button you see there is 0 point. It should be right about in the center of the triangular fossa that you see here. It's about in the center of the triangular fossa. So we look straight across from the concha ridge here for the shoulder, straight across from the inferior crus for the elbow, the center of the triangular fossa to find the wrist. This is where you would treat the wrist. The yellow button you see here is the Shinmen point. The green one that you see here is autonomic that goes right back at the very end of the sacrum spine. The white one you see here is a 0 point. The thalamus, related to the cortex, is right in the center of the endotrachus, where the endotrachus meets the concha floor, as you see here. There's a point that this one is not in. It's right here that's called endocrine point for hormonal control. It's right there. That's the 5 major master points. So the back of the ear corresponding, if you were looking for the hip point, or pull this one out of 0 point and put it in the hip point right here, the motor neurons, as it comes out right back here, that's where you'd find the motor aspect of the hip joint. Here's where you'd find the shoulder, back of the ear. Just put your fingers like a C-clamp to find the back of the ear. You must keep the ear clean and dry. If you're not doing the auricular cardiac reflex, which is now termed the VAS, which I don't know too many that are really heavily successful with it, electrical diagnosis measuring in megohms is a good way to go. Is looking at just the greatest differential point. We measure that in megohms, which we'll show you just in a few moments.